Spotlight on Berkeley Heights is provided by funding from DeFabio Chiropractic, where integrity, thoroughness, and a friendly staff have been servicing the community since 1985. DeFabio Chiropractic is where an accurate diagnosis leads to rapid pain relief and better function. Located on Springfield Avenue in Berkeley Heights, it's the natural choice for your healthcare needs.
Welcome to Spotlight on Berkeley Heights, the pulse of the community. Today we have with us a repeat guest, Dr. Jeffrey Rosenberg from the Summit Medical Group. He's a sports medicine doctor. He's going to talk to us about some sports medicine problems and what we can expect when we have a sports medicine visit. Dr. Rosenberg, thanks again for coming out today.
My pleasure. My pleasure.
You know, the concussion show was great. I got a lot of really good positive feedback on that.
Excellent, great. I enjoyed giving it, so I came back for more.
There you go. I guess that's a good thing.
Yeah, absolutely.
I guess that's a good thing.
Yeah.
Now, people want to contact you. They're going to contact you at the Summit Medical Group again. That's okay, isn't it?
That's correct. Yep. Just call the main number at the Summit Medical Group. The operators all know how to find us. So.
All right. Well, that sounds good. So get ready for some more fan mail.
Okay, it works.
Now, you're a sports medicine doctor.
Yes.
What is a sports medicine doctor? I mean, I see it all the time. Treats sports medicine, treats athletes, sports care.
Right.
I see that all the time.
Yeah. Well,
what is it?
Well, the field of primary care for sports medicine really came out only within the past 20 to 25 years. Basically, it was an issue of that orthopedic surgeons like to do operations. If you have a problem that you don't need to operate on, after a while, they're really not quite so skilled at taking care of you or wanting to take care of you. And most internal medicine and family practice-like docs don't really have the time or the cognitive ability or the knowledge to kind of go in there and really treat some of these orthopedic and musculoskeletal complaints. So when do you go to the doctor? Because you're in pain, and usually it's some kind of joint or muscle that's bothering you. And so my training is to basically allow me to be comfortable treating any kind of real orthopedic or sports injury, from an 8 or 9-year-old kid all the way up to a 90-year-old. I even saw an 80-year-old lady the other day that still runs 10 Ks every year. So there's
That's
a lot,
great.
yeah. And with the aging population, there's just more and more people that are older athletes. And people always say, "I know I'm not really an athlete, but my knee hurts." You don't need to hurt yourself on the field if you're just exercising, or even if you're just hurting because you've got arthritis in your knee. I'm more than comfortable and comfortable and wishing to take care of folks like that.
Tell me a little bit about your training.
I went to Mount Sinai Medical School, which is here in New York City. I did my residency at Thomas Jefferson University in Philadelphia in family practice. Actually worked in a variety of settings for 5 years, and I went back and did my sports medicine training.
They have a very strong sports medicine department down there, don't they?
Yeah, they do. Yeah, Philadelphia's been one of the big centers of sports medicine over the years, and my fellowship director was actually one of the first fellows in the country in sports medicine. So I kind of really learned from people who are just starting this field. At the very high level of primary care sports medicine are doctors who take care of college teams or all the pro teams. Most of them will have an orthopedic surgeon, and they'll also have more of a medical physician, and that's usually what docs like us do.
So from a sports medicine perspective, does that integrate with internal medicine, or are they different?
They're different and they're same. I mean, in my practice here, I'm actually lucky enough to be able to do regular family practice and adult internal medicine, as well as do sports medicine. A lot of other places you can kind of do one or the other, but not both. Sometimes it's insurance companies' issues, sometimes it's just the interest of the doctors. But I'll see somebody with a bad knee, and then I'll see somebody for a physical and diabetes right afterwards, and then I'll go back to the 8-year-old with a bad ankle. So I'm really lucky to be able to do a little bit of everything here.
That's exciting.
Yeah,
That's exciting.
Yeah, and what we do in sports medicine, obviously, is try to really diagnose the thing that hurts. We don't want to just say, "Oh, you sprained your knee." We want to tell you what ligament it is, and we want to know what tendon it is that's injured, because really the better that we can identify the problem that's causing you the pain, the more likely you'll actually be able to get better from that. And so, treatment is when people come to see me, we talk a little bit about what's going on. I examine their joint really well and check for range of motion and function, make sure that all the mechanics are working well. And then when we talk about treatment, obviously I use a lot of physical therapy and physical therapy-like modalities to get people to get people better. I'm the first to admit that I don't make patients better. It's the hands-on folks like you and like other physical therapists and manual-based treatment that really makes the big difference.
Well, we appreciate the shout-out, Doctor.
Yeah, absolutely.
Thank you.
You guys do all the work. So.
Well, the body does the healing, but it just needs that little help to get it going in the right direction, you know, to get the inflammation down or get the tissue integrity back. Well, I guess that's really a lot of things you do too, is to get the ligaments and the tendons to be structurally more sound. No, with sports medicine, you have some tricks up your bag for that,
we've got all, I mean, other than, you know, normal casting and cortisone shots and things like that, which we can talk a little bit later about the utility of those, you know, there are other things that we do now in sports medicine that can help improve the body's healing. So many people have kind of more chronic pain, often need something to kind of re-stimulate the body to restart the healing process. You know, there's an injury, it didn't heal right the first time. We try to do something to injure that area again so that the body's immune system and inflammatory system can kind of do what it wants to do. Inflammation's given a bad rap, but really it's an important part of the healing process. And if we don't allow inflammation to do its thing, sometimes we're left with more chronic problems.
We're going to talk about that process and how laying down or getting the body to stimulate to heal. Before we do that, I want to just ask one question about inflammation.
Yes.
There's some circles they talk about using omega-3 fatty acids, fish oils as an anti-inflammatory type of approach protocol.
Right.
What's your take on that?
You know, I think that I don't have a huge experience on that for anti-inflammatory properties, but I have really believe that omega-3s and other fish oils are probably very good for us for all parts of our body, whether it be the connective tissue or the joints or the brain or heart. So I'm a big proponent of it. It's actually one of the things that we are starting to use for concussions is very, very high doses of omega-3 fatty acids, because they do seem to help improve the nerve's abilities to kind of regenerate and to heal up.
Cool stuff.
So it's something that's down the pike. You got to take a lot of omega-3s though to help your brain after a major concussion. That's for sure. 4,000
milligrams.
Or even higher. I mean, I know I've seen even 10,000 milligrams a day,
Okay.
and to the point where you're almost bleeding. You have so much omega-3s in you.
Yeah. Well, interesting. Well, a little tip they picked up from the last show. They can correlate.
That's right.
So we're going to take a short break, Doctor. When I come back, I would like to talk about some of the advances in stimulating muscles, tendons, soft tissue to heal a little bit more quickly, because I know there's some interesting things you've been doing. I'm Dr. Donald DeFabio. My guest is Dr. Jeffrey Rosenberg.
A healthier you can be a lot easier to achieve than you think. Often the most effective way to improve your health is to make consistent, small, positive changes. According to experts at the Foundation for Chiropractic Progress, it's best to try to balance your diet, emphasizing fruits, vegetables, whole grains, and beans. Reducing or eliminating your intake of harmful foods, like sugar, soda, fats, and processed foods. Drink plenty of water, especially in the hot summer months. And remember, a nutritious breakfast is the most important meal of the day. You don't have to run a marathon to shape up. Just do some form of exercise regularly. Aim for 20 to 30 minutes, 3 to 4 times a week. Learn how to stretch properly, walk with supportive shoes, and lift some light weights. Attitude matters too. Staying optimistic can lead to greater success in a goal of a healthier you. Chiropractors are experts on wellness and can offer lifestyle advice. For more tips, visit yes2chiropractic.com. A new crop of players has been voted into the Pro Football Hall of Fame. While you might assume his 13 trips to the Pro Bowl, 38 career records, and 3 Super Bowl rings are what made San Francisco 49ers star receiver Jerry Rice a shoo-in for the Hall, he says you can also credit his chiropractor.
My first experience with chiropractic care was right before the 49ers were to play the Bengals in Super Bowl 23. A couple of our players were injured, and a chiropractor turned things around.
Rice, who says a chiropractor helped him weather countless bone-crushing hits, also spent time with the Raiders, Seahawks, and Broncos. Today, he's a spokesperson for the Foundation for Chiropractic Progress, a not-for-profit organization dedicated to increasing public awareness of chiropractic care. He even credits such care for helping him succeed in what some have humorously called his second career, performing on Dancing with the Stars. For more information, visit yes2chiropractic.org.
Welcome back to the show. Dr. Rosenberg, there's some really cool things you're doing with stimulating tendons, ligaments to heal.
Yes.
You'd mentioned a little bit about that in the first segment, how you can stimulate, create more inflammation to promote healing.
Right.
Tell me about that.
Well, one of the concepts of what's called tendinopathy or tendinosis is that you've got basically scar tissue that forms in your tendon. A normal tendon, when you look at it underneath the microscope, the fibers of the collagen kind of line up like the pasta does in a box of spaghetti. Okay. It's parallel, it stretches really well, it's really happy. People have chronic tendon problems, chronic tennis elbow, it's in the rotator cuff, it's in the Achilles, you pick a tendon and all is the same. When we look at this collagen underneath the microscope, it's more like a plate of spaghetti. So the collagen is all wound around itself, and it's really kind of tight and stiff, and it doesn't stretch. And because it doesn't stretch really well, it's stiff, stiff in the morning, stiff after you do things. And there's also other neurological scar tissue in there that causes the area to be in pain. And what we don't have is good blood flow into the area, so the body can't heal it. So it's scarred down and it's kind of stuck like that. So there are a variety of concepts a variety of things that are now done to try to help stimulate the immune system to fight that area of scar again. And what we have to do is basically purposely irritate the area, get some more blood flow into the area, which will then bring in more inflammation, which will then hopefully allow the body to get it to heal it better the second time than it did the first. The easiest or the first steps I usually do are more manual-based things, kinds of things like you do, either with massage therapy or Graston, ART, all kinds of things that really physically get in there and use your fingers to help kind of soften up the scar and to stimulate and irritate the area. The next set of treatments are things that are done with injections and needles. So we know that if you were to just put a needle and basically use a needle to put a bunch of holes in the tendon, one hole on the outside, lots of holes on the inside, into your tendon, you get that area to bleed. Again, you bring in more inflammation. And that's kind of the first thing that I initially had seen when I was a fellow years ago.
Is that dry needling?
That's what dry needling is, yes. Okay. And then the next step from there is using other substances to irritate the area, either as part of a small dry needling procedure or maybe not without needling, but just as an injection. Those can start, the lowest level of that stuff now is called prolotherapy, which is really using sugar water, very high doses of sugar water. Dextrose at very high concentrations is a pro-inflammatory.
Normally higher concentration than what we would drink?
Yeah, it's about the 25%. So 25% sugar water, 50% sugar water is really thick stuff. But if you inject that into an area, that causes local cell death via osmosis, and that's what stimulates inflammation.
And then the body lays down.
And then, right, so all of these things start the inflammation to bring in new healing cells, to clean up the junk, bring in new progenitor cells that kind of help to lay down healthy tissue again. And during all these processes, you're not immobilized. We've learned that's not really good for very much anymore. But you want to move your joint. You want to be using the muscles and the ligaments, and they get to stretch out while they're healing so that they kind of heal in a healthy way and not just all tight and stiff like they will for these people with chronic scar tissue.
So motion is life.
Motion is good.
And we want to get them inflamed.
Right,
all these
absolutely.
years we've been slapping ice on them and telling them to shut down inflammation.
Right. I mean, inflammation is painful.
Line?
Yeah, I mean, inflammation is painful, but it's important. And those first 5 days of inflammation are really what start the process. So I'm actually a much bigger proponent of non-anti-inflammatory medications. So I use a lot of Tylenol or what's called acetaminophen generically for pain control. But I'm not a big fan of anti-inflammatories because, again, some of that inflammation is actually really helpful. If you are going to use them, I tell people use very little. You're not using high doses of anti-inflammatories to get this to heal. What you're going to try to do is just take some of the pain away.
So those are your Aleve, your ibuprofen?
Profens, yeah, Motrin, Advil, that stuff, and Celebrex and more prescription kind like that are some of the anti-inflammatories, which, again, have their proper roles in certain places, but for these kind of acute injuries, I'm not as big of a proponent of them as we once were.
What about ice? Where do you stand on ice?
Ice is, ice does the same thing. Ice kind of prevents blood flow. We kind of want blood flow. Ice is probably a little bit of ice is okay for the first few days, but not chronically. And again, when you're feeling kind of stiff, heat is much better. It brings in more blood and allows things to kind of loosen up a little bit. So I tell people, and people are very surprised, but I tell people a lot less anti-inflammatories, a lot less ice than we used to. Obviously, if your foot's swelled up like a balloon, some ice or some anti-inflammatories is not going to bother that. But if you don't have a lot of inflammation and you start taking a lot of anti-inflammatories, you're going to stop that little bit of inflammation you've got going, and you may prevent yourself from healing up so well.
Interesting.
Yeah,
so
again, some new thoughts.
And it also goes back to working with a doc that is
comfortable doing some of the stuff.
Comfortable and kind of on the cutting edge. Because this is new information, I think, for a lot of people.
Yeah, absolutely.
It's not ice for 24 hours and then go to heat and, immobilize it.
Right, exactly.
Yeah.
Right.
Glucose?
Oh, glucose water, right?
Yeah,
Okay.
what else do you
So
inject?
other things that we do now include
Something called PRP.
PRP, right? So
What is that?
PRP is what's called
It's an injection, right?
Yes, it's called platelet-rich plasma. What it is basically we take blood out of you, we spin it down and just get the platelets. The platelets are the part of the body that basically start the inflammatory process. So instead of just getting an area to bleed, we're putting very high doses of platelets, super physiological doses of platelets into an area to really cause inflammation. And this is like kind of a big gun of inflammation to really get an area to kind of heal up again. Again, that's really most useful in people who have these chronic degenerative tendon problems that really need a big dose of inflammation to kind of heal this up. So that's an injection-based treatment. In between that, for a while, people are actually just using blood injections. So they take a little bit of blood out of you and they put that blood somewhere else. Blood is very inflammatory. If you think about it, when you get a bruise, you sprain your ankle, it turns black and blue. All that bruising and black and blue that you see it basically causes inflammation, and it hurts a lot. And so, again, in this setting, we're trying to do that on purpose, not letting it happen as part of an injury, but we're doing it purposely, somewhat controlled, to try to help induce the body to bring in some inflammation and to really heal up these chronic problems.
These injections.
Yes.
For tendon, for muscle, for ligament, for cartilage.
People are trying it for a lot of these things.
Okay, so it depends on the individual. Could be possible.
Depends on the problem. Yeah, I mean the best data is using it for tendinitis. So like tendinopathy, so like tennis elbow, chronic lateral elbow pain is kind of the easiest one to treat with these injections. That's the one that's kind of easiest studies. It's hard to damage it, but you can do a lot to really make people feel better. They also have tried to use this as part of, let's say, rotator cuff surgery. If you're going to get your rotator cuff repaired to kind of induce some extra inflammation there, that hasn't panned out as well as they'd hope. But usually for tendon and ligament issues is where it's been used. Probably for most muscle injuries, most of the muscle injuries heal up pretty well on their own, and rarely do people have chronic kind of muscle.
Because they got good blood flow.
Because they got great blood flow, right? Tendons don't have blood flow in it very well. So muscles do have great blood flow. And then the newest thing is to actually use what is called stem cell-based treatments. So there are people that are now, there's only a few places in the country that do this now, but do a bone marrow aspirate, take out your stem cells from your bone marrow, and basically take those, they isolate them, and they grow them, and they basically then inject those stem cells directly into the area where the injury is. Those have been tried for, let's say, articular cartilage defects into a knee joint or a shoulder joint, and in some more of, and also used for tendons and ligaments. It's a technology that's coming along. I don't think it's quite there for everyone to do yet, but it's the next 5 years.
Cool.
Everyone's always in, even I see 60 and 80-year-olds in, what's new in arthritis? What can I do so I don't have to get my knees replaced? And unfortunately for them, very little. Most of these treatments really can be most useful for young folks who have kind of small defects or small injuries that need to be healed and have blood and have enough of a healthy system to really make things better.
So we're going to take a short break.
Okay.
When we come back, I want to find out, how do you know where to give these injections?
Okay.
Because giving an injection is one thing. Getting the PRP, the plasma, the glucose, stem cells, getting it to the right spot.
It's very important.
Yeah, exactly.
Yeah, absolutely.
Dr. Rosenberg, I'm Dr. Donald DeFabio, and we'll be right back.
Whether you're a weekend warrior or a pro athlete, the wear and tear of sports, let alone everyday life, can take its toll on your body. It's a lesson learned all too well by future NFL Hall of Famer Jerry Rice. Rice took countless crushing hits during his nearly 20-year career with the San Francisco 49ers and Seattle Seahawks. Now, he's telling how he weathered them.
My first experience with chiropractic care was right before the 49ers were to play the Bengals in Super Bowl 23. A couple of our players were injured, and a chiropractor turned things around.
Rice has been convinced ever since. In fact, he's now a spokesperson for the Foundation for Chiropractic Progress, a group dedicated to increasing awareness of chiropractic care. Not only can such care treat aches and pains, but it can also improve posture and prevent injuries. A major benefit to Rice during his time on Dancing with the Stars.
Again, chiropractic made the difference and kept me dancing and in the competition.
For more information, visit the2chiropractic.org.
Humans may have been sitting since the caveman days, but apparently we're now overdoing something that's giving many of us chronic lower back pain. What? Driving. According to experts, millions of Americans experience the most common form of back pain, muscle tension, the result of drivers remaining in a static position while maintaining a heightened sense of awareness. The Foundation for Chiropractic Progress explains that driving requires constant alertness and tension, which can itself create the scenario for muscular pain. Extended periods of sitting can cause added pressure to the lumbar spine and compress surrounding soft tissue. Doctors of chiropractic are trained to improve structural positioning and can offer preventive expert advice. First, sit closer to the pedals, avoiding full leg extension, and keep arms bent slightly in the 10 and 2 position on the wheel. Second, never place bulky items in your back pocket. Third, break up long journeys into no more than 2-hour segments. And finally, place a pillow in the small of your back to improve posture. Learn more at yes2chiropractic.com.
Are you or your child at risk because of the weight of your handbag or backpack? Could be, says Dr. David D. Oliveira of the not-for-profit Foundation for Chiropractic Progress. He explains.
Heavy bags can strain your back, arms, neck, and shoulders. That's why handbags should weigh only a pound or two, and backpacks no more than 10 to 15% a child's own weight.
If you do develop pain, a chiropractor should be consulted for evaluation and treatment. Learn more at yes2chiropractic.com. Former San Francisco 49ers star receiver Jerry Rice says part of the credit for his recent induction into the Football Hall of Fame belongs to his chiropractor.
My first experience with chiropractic care was right before the 49ers were to play the Bengals in Super Bowl 23. A couple of our players were injured, and a chiropractor turned things around.
Rice is now a spokesperson for the not-for-profit Foundation for Chiropractic Progress. More information is at yes2chiropractic.org.
Welcome back to the show, and we're going to find out how Dr. Rosenberg could actually isolate the tissues that need to be treated. How do you know where to give that injection, doctor?
Well, the best way to do that is actually to be able to see into the tissue, and of course, you know, if you have an MRI.
Oh, can I have a pair of those glasses?
Yeah, so those glasses don't exist yet, but you know, MRIs, we can't, you know, do anything in somebody under an MRI, but what we can use is ultrasound. Ultrasound is very easy. It's an office-based machine that is
like
relatively
a sonogram?
A sonogram, same thing you'd use for your babies and your gallstones.
Okay.
And I use it to look at ligaments and tendons and into joints. So I can see an area of damage on a tendon. I can see an area of muscle damage. I can't see into a joint very well yet, but that's coming along. Ultrasound doesn't go.
The technology's not there?
Yes, I mean, ultrasound bounces. The sound waves bounce off of everything and come back. So you can't bounce anything off of bone yet. I mean, it doesn't go through the bone. It just all bounces back. So you cannot ultrasound anything past bone. And so for getting really deep into the joint or to see where there are cartilage problems, you can see pieces of them as long as you can bring that cartilage to the surface, but a lot of the joint is kind of hidden by the other bone, and so we can't visualize that very well. But utilizing ultrasound, we can perfectly see an area of damage, an area of a fluid collection, fluid around a tendon that's not supposed to be there. And so using ultrasound to kind of guide the injection is really the best way to do that.
So it'll actually tell you where to do it, and you can inject at the same time?
Yes, I use two hands. One hand holds the probe, and I'm watching the machine. The other hand guides the needle in. You can actually see the needle on the machine and on the screen, and you can see the fluid going into the right spot. It's actually really great.
Very neat.
I also do that a lot for joint injections, so for knees and shoulders and a lot of the smaller joints that are sometimes harder to get into. Certainly, many studies have shown even if you take a very skilled practitioner, whether it be an orthopedic surgeon or a family practice doctor or a physiatrist, and have them do injections into something as easy as a joint, which most of the time we're really comfortable we're in, about 10 to 15% of the time you're actually not in the joint. But with ultrasound, you can actually prove and tell that the fluid's going exactly where it needs to be. So it's a great way to help improve the accuracy of injections, to help improve, and therefore improve its likelihood to make you better. And it's usually less uncomfortable for a patient, again, if you're putting the needle exactly where it needs to be. I use, you know, anesthetic, numbing medicine, just like you use at the doctor, to kind of numb up the areas before I do any invasive treatments. But it's really wonderful, and patients love kind of being able to see the needle go into where it needs to go, and they can see the fluid or whatever it is that they're doing, that I'm doing. They love to kind of watch it along. So it's a really nice technology. It's very fun.
Good. Well, that's exciting to know.
Yes.
You used a term that some of our really astute viewers may pick up. You went tendinopathy.
Right.
Okay. And you mentioned it a couple of times.
Right.
What's the difference, and why would you choose to use tendinopathy versus tendinitis as
Well,
a term?
yeah, I mean, the term itis is Greek or Latin, I don't remember which, Greek. I think it's probably Latin for inflammation. And so a tendinitis is an inflammatory problem. Again, when you first injure yourself, those first 4 to 6 weeks, you have an inflammation there, it's a tendinitis. More often when I see people have had a problem, it's been going on for years. That tendinitis, that tissue does not have any inflammation in it. When we look underneath the microscope, there's no healing going on. It's just scar tissue. And that's what the term tendinosis really is it's the abnormal collagen tissue without blood flow, with little tears in it. Sometimes there's little calcium deposits in it. And that's what the term tendinosis really means. And that tendinosis process can happen in most of the tendons in the body. The most common ones are the tennis elbow and golfer's elbow, which is the inside of the elbow, rotator cuff, so inside of the shoulder, the Achilles, and all of the major tendons of the foot and ankle. And then your patellar and quad tendon. They're the big ones. And
So
the last
I
one
get
is
confused. Tendinosis, tendinopathy are the same thing?
tendinosis and tendinopathy really mean the same thing,
Okay,
yes.
all right.
Tendinitis or an itis is different than the osis or apathy.
Okay.
Yeah.
And then the knee was?
And the knee, patellar tendon and quadricep tendon are the most common places. So, you know, I see a lot of kids who are playing basketball or volleyball, and it seems to me like every high school kid's got knee pain at some point in their lives, and I think anyone who's an athlete would remember having some pain. But having a lot of pain or having long-standing pain is a different story. And so one of the most common causes of that pain in the front of the knee in high school kids is tendinopathy of the patellar tendon. And so we do see a lot of that. And again, I don't do quite as aggressive injection techniques at the beginning, but sometimes even kids in high school need some of these treatments done.
Sure.
Yeah.
That makes sense. Now, in terms of prevalence of injuries, are you seeing a trend at all, you know, in your practice?
Yeah, I think that what we feel in the sports medicine world is that there's a lot of overuse injuries. And by overuse injuries, these tendon problems are one of them. The other are growth plate issues. The intensity of most student athletes now is much higher than it used to be. The amount of training that they're doing, both on and off season, and the fact that you're playing one sport all year round.
What about that?
Yeah,
What's
it's
the
not so
stats
good
of-
for your body. So when you're playing the same sport all year round, you're only exercising those parts of your body that are relevant for that sport, which is great. But if you're a tennis player and all you use is your right arm to play tennis, you haven't done anything to help your left shoulder. You haven't done anything to help your trailing foot as far as exercising. So one of the things I think we used to see is more three-sport athletes.
Sure.
You'd see, when I was at high school, not that I was, but many people played 2 or 3 sports and were very good at all of them. And they typically make a better kind of all-around athlete than somebody who does the same thing every day.
Well, I
It's
know
not,
the
just
current-
not as good as your body for your
It's
body.
my understanding the current stats are an average professional athlete still plays 2.4 sports, okay? And there is no correlation between excelling in a sport at the high school and college level and being a single sport athlete.
Right, that's true.
There is no correlation.
Right, yes, no, I agree with that.
So, and then I also believe it's the American Pediatric Association Sports Council said something they only should be playing one sport for 9 months of the year and then swap out.
Yeah,
for
that's
3 months
probably
of
the
year.
maximum. Yeah, I mean, I think 9 months is probably the maximum amount of time you should be doing one sport all year round. Taking a month off, which a lot of kids will do around July or August, it's not even quite enough. You really need a few months of doing something else to kind of help balance out some of your power and some of your strength and some of your endurance and flexibility and such.
So maybe the bottom line is to keep the kids out of our offices, huh?
Yes, that would be great. We'd certainly love to do anything we can. We don't want to see your son in the office, but people, pitchers now all year round they're pitching. It's just bad for your shoulder and bad for your elbow. So
I mean, kids want to pitch if they're at the youth level, even into 9th, 10th grade. I'll say, you really want to pitch? Then don't pitch.
Right.
Play the outfield.
Right.
Wait till your body matures.
Right.
Let everybody else throw their arms out. You wait till you get
you'll
to
be
college.
you'll be the last one standing for sure.
Yeah,
And
exactly.
that's a good thing.
Well, Dr. Rosenberg, another great show. We really appreciate your time.
Thanks.
And thanks for letting us come down into the sports medicine world here at Summit Medical
My
Group.
pleasure. It's been nice talking to you.
Pleasure is mine. We look forward to seeing you soon. And
Okay, great.
Will you
Thanks.
come back for another show?
Oh, absolutely.
All right. He'll be a three-peat on Spotlight on Berkeley Heights. I'm Dr. Donald DeFabio. Thanks for watching us. And if you have any questions, please contact the Berkeley Heights Communications Committee. Have a great day.